In this video, we are going to talk about jaundice and hyperbilirubinemia in newborn babies. So, jaundice is a yellowing of the skin and mucous membranes that occurs when bilirubin accumulates. In our blood, we have a protein called hemoglobin that carries oxygen around. We make bilirubin when our hemoglobin breaks down. This is a normal process. Fetal hemoglobin breaks down after about 70 to 90 days, while adult hemoglobin breaks down after about 120 days. There are two main processes that contribute to normal newborn jaundice. After your baby is born, they need to switch over from using their fetal hemoglobin to using more mature hemoglobin, so we have an increase in the amount of bilirubin from the breakdown of that fetal hemoglobin. The second thing that contributes is that bilirubin is filtered out of the blood by little newborn livers. The bilirubin is then passed through as the baby pees. However, newborn livers are not at 100% function at birth. When they are fetuses, you are getting rid of their bilirubin through your liver. They didn't have to do it themselves. So, when we have that extra bilirubin and a slower method of pulling it out of the blood, you get an accumulation that leads to jaundice. Try saying fetal hemoglobin 60 times fast. About 70% of newborns will experience some level of normal jaundice, with levels peaking around days 3 to 5 postpartum and lasting for a few days to a couple weeks. Jaundice is first visible in the eyes and mucous membranes, like their gums. It travels down the body from the head to the trunk. Normal jaundice often occurs in exclusively breast and chest-fed babies, as there is a substance in the human milk that inhibits an enzyme the baby needs to help excrete the bilirubin. Bilirubin also has antioxidant properties for the baby when present in low amounts, so it might serve a purpose for a healthy baby. Sunlight helps your baby change the bilirubin into a form that is easier for them to get rid of, so give your baby some safe sun time and keep them well hydrated, and it should fade away. There are types and levels of jaundice that are not considered normal and healthy. If your baby has jaundice within the first 24 hours of life, for example, this can be caused by infection, injury, and bruising, or concerns with your baby's blood. Hyperbilirubinemia is the buildup of bilirubin in the baby's system beyond a safe level. If bilirubin levels get too high, it can build up in the baby's brainstem and cerebellum, causing potential motor deficits, hearing loss, or can be life-threatening. Babies with hyperbilirubinemia may be lethargic, with low muscle tone, and will have difficulty waking for feedings. This creates a cycle where the baby isn't feeding well and then isn't getting adequate hydration to flush the bilirubin from their system, and then they're getting sleepy, and then they're not feeding well, and it keeps going. Babies might also be irritable and have a high-pitched cry. I do want to note that babies sleep a lot, and a well-fed, hydrated baby may have their interactive time and then pass out after feeding and be totally fine. A lethargic baby isn't interactive in the same way when they are awake. They just aren't entirely there with you. It's always important to let your midwife know if you think your baby is sick. In general, visual assessment of jaundice isn't super accurate on its own. It can be harder to see if your baby has a darker skin tone, for example. If you notice that their jaundice is increasing in intensity or yellowing to their limbs, or you have any concerns about their behavior, please let your midwife know. Hydration is the first-line treatment for jaundice, as baby excretes it in their urine. Meconium is a reservoir for bilirubin stores in utero, and therefore the faster the transition from meconium to more mature stooling, the less bilirubin can be reabsorbed into their intestinal tract. Your midwife will help you create a feeding plan that keeps your baby well and hydrated. Let them know what your feeding goals are and if you are having difficulties. Bilirubin levels can be tested with a blood test done by pricking the baby's heel. If you stay in the hospital, this test is normally done at 24 hours of age for all babies. If you have any risk factors for increased jaundice, your midwife will recommend staying in the hospital postpartum. If you go home early from the hospital or have a home birth, your midwife can arrange for you to return to the hospital the next day to have the test done, or can arrange to have the test done if any concerns arise during your postpartum care. We screen babies for abnormal jaundice at every visit by looking at their color, assessing their feeding, their behavior, and their pees and poos. If the blood tests indicate that the levels of bilirubin are high, phototherapy is the second-line treatment after hydration. Think of it like a little baby tanning bed in the hospital. They even get little goggles to protect their eyes. They usually need this therapy for about 24 hours. The UV lights oxidize and conjugate the bilirubin and make it easier for the baby to excrete it. You can still breast or chest feed your baby while they are getting phototherapy, although formula may be recommended if they need an increased volume to help flush it out with their pees. If a baby has very high hyperbilirubinemia, baby may be offered a blood transfusion. This is to avoid progression to kernicterus and potential brain damage. So, in summary, a little bit of jaundice in the first week is usually fine. A lot of jaundice, or jaundice in the first 24 hours, may need some medical assessment and treatment. Your midwife will assess your baby at each visit, help you learn what to look for and when to contact them. Take a look at the info linked below in the description for more learning.